Hello and a very good afternoon to everyone. Welcome to today's session on sperm morphology and IVF by Apollo Fertility. We would like to welcome Dr. Sujala NS, who is our in-house senior embryologist at Apollo Fertility. She has done her BDS at Brookfield and her PG diploma in clinical embryology from Manipal Academy of Higher Education. We welcome you, Doctor. You can now take over the session.
Hello, good afternoon, everyone. Welcome to today's session. I'm Dr. Sujala from Apollo Fertility Brookfield. Today's topic is sperm morphology and IVF. So, what is sperm morphology? Sperm morphology is nothing but the morphological assessment of the sperm. So, why do we assess the sperm morphology? Because male factor is responsible for 30% of infertility. Abnormality of male factor is mainly assessed by the basic semen analysis. Seminal analysis is the basic procedure which assesses the sperm parameters. The three basic sperm parameters are sperm count, sperm motility, and sperm morphology. Count and motility will vary accordingly, but morphology is very crucial when we are planning for the infertility treatment. Morphology, especially if the morphology is poor, it will change the treatment course required for the concerned couple. So, AS is the advanced semen analysis, which also provides the basic parameters along with the DNA fragmentation in the sperm, which will result in abortion. But the basic assessment should during infertility treatment should be always done through semen analysis. So today our focus is mainly on sperm morphology and how does it impact the IVF outcome. There are several studies which have shown the importance of sperm morphology and the IVF. So let me introduce what is sperm morphology. Sperm morphology is nothing but microscopic analysis. So it is only analyzed through a microscope, a fluorescent microscope or a phase contrast microscope to assess the shape, structure, and size of sperm. A sperm usually has three parts, that is the head, neck, and tail. In fertility assessment, we go through all the features of the sperm: head, midpiece, tail, what is the size, what is the shape, what is the structure, everything, and any abnormality in any one of the part is given as poor morphology. Sperm morphology is very important because even in healthy fertile man usually produces high percent of abnormal sperm. Many men get results, 50% of the result may show abnormality in shape and structure. But the matter is, if they have 4% normal form, means out of 100, if they have a 4 normal form, they'll be able to conceive. Why is abnormal sperm important is it is a challenge for conception when you have a poor morphology, that is 0%. There are several studies which have shown that even with 0% normal form you will be able to pregnant your partner, but the conception rate or the percentage is very less compared to fertile people who have normal forms. So if there are that chances in people having more normal forms, sperm morphology will be 55 to 60% compared to people who have 0% normal form. So, what is a normal sperm? How does a normal sperm looks? A normal sperm has a smooth oval shaped head, and the size of the head is just 5.6 microliters long and 2.5 to 3.5 microliters wide. It has a well defined gap that is called the acrosome, which occupies 40 to 60% of the head. And the midpiece is the neck, which has the mitochondria, and the tail, which has the protein. Why I'm explaining each part is because each part plays a crucial role in fertilization. If the head is abnormal or if the acrosome is less, the sperm will not be able to penetrate the egg, which has a thick zona. And if there is any defect in the midpiece, there will be no mitochondria. The mitochondria is the energy source which helps in motility of the sperm. So that will result in low motile. When the motility is less, the chances of pregnancy with IUI or natural conception is very negligible. So why do we need a normal sperm? Why do we need a normal sperm with an intact head, midpiece, and tail? Is to penetrate the egg, and it has to fuse with the egg to leave its genetic load, and in order to form a functional embryo, which is crucial to form a healthy fetus and a healthy pregnancy. So, how do we determine the sperm morphology as normal and abnormal? There are two criteria. The two criteria, one of the criteria is the WHO criteria, according to which out of 100, if we get above 4 normal form means the head, tail, midpiece, everything should be intact. If we get that, then it is called as normosospermia. And if there is any defect in head or neck or tail, we don't consider it as normal, and that will go to category of teratospermia. The other criteria is Kruger's strict criteria. Here in the Kruger's method, it is more stricter than the WHO criteria, because in Kruger's we measure the size of the head, neck, tail. So they consider anything above 14% as normosospermia. So, sperm morphology will help in embryo development. So, if you have poor morphology, the grading of embryo will be, the grade or the quality of the embryo which you are getting will be poor. Hence, the chances of pregnancy reduces. Then, when the sperm morphology is good, when a sperm is morphologically intact, it is assumed that it is genetic DNA is intact. So, when the DNA is intact, the chances of healthy implantation, healthy pregnancy is high. So, when there is abnormality in the acrosome, post acrosome, or vacuoles, then there is no DNA integrity, which can result in abortions, and a higher rate of abortions will be there. So, many studies have published that there is increased risk of aneuploidy. Aneuploidy means the chromosome number will be abnormal, and diploidy. So, when the morphology is poor, this can result in an aneuploid or a diploid embryo or a zygote. And the reduction in ongoing pregnancy rate means it can result in abortion, biochemical pregnancy, then missed abortion, clinical abortion. So, all this will be at a higher rate. Then, the implantation rate means you will not have a positive result after your transfer. So, that rate will also be reduced. This is mainly the role of the intact DNA which is present in the sperm head. So, what can be the cause of abnormal sperm morphology? There can be two causes. One can be genetic, and one can be the non-genetic causes. The genetic causes can be globosospermia. Globosospermia is a more technical term. It is globosospermia is nothing but the sperm head is round. It is globe in shape. A normal sperm will have an oval shape, but in globosospermia, the size of the head will be small and it will be round in shape, due to which there will be no acrosome, or there will be a very minimal acrosome. When the acrosome is less, it will not be able to penetrate the egg and cause fertilization. So that one is the genetic cause. The other thing is short tail syndrome, in which there will be a defect in the tail protein synthesis, and the flagella movement will not be there, due to which the consumption with natural pregnancy is very negligible. The other thing with spermatozoa with disomy means there will be abnormality in the chromosome count, due to which also there will be a high rate of abortions. All these causes, which are due to genetic, are mostly permanent and irreversible. But there are treatment, and there are studies which have shown that there are pregnancy with globosospermia, where we will use oocyte activation factor. Means when globosospermia, if the sperm is not able to activate the sperm itself, ICSI is recommended. ICSI is nothing but IVF procedure, that is intracytoplasmic injection of the sperm, where a single sperm is taken and injected to the oocyte. So here the sperm is injected, and due to the round head and defect in the PLC zeta calcium, activation media is used, due to which the chances of fertilization will be more, and you might have a good embryo and a good transfer. So there is not like very high percentage of pregnancy, but cases have been reported that with globosospermia also you can have a pregnancy, but it will be always through IVF. So even in short tail syndrome also, because when you have planning for a natural consumption or IUI, the tail is very important because the motility is very important for the sperm to itself reach the ampulla where fertilization occurs. But when you have a defective tail, or when the tail is short or the motility is less, then ICSI is recommended. IVF is also not recommended in this procedure. Directly ICSI is recommended. So in these cases, ICSI is the planned procedure. But you can always not have pregnancy in the first try or a first attempt. You should try for multiple attempts, because there are low for means even if you use oocyte activation media or any other techniques, there will be low birth rate and little poor grade embryos. So the other non-genetic causes are lifestyle or lifestyle activity, then obesity, smoking, use of alcohol, psychological stresses, then urogenital gland infection and varicocele. This gland infection and varicocele, they will cause high temperature, due to which the motility of the sperm will be decreased. So these can be the reason if you are recently infected, or recently if you have taken any antibiotic, or you are having high grade fever, or you have undergone any procedure in the urogenital tract. We always ask during analysis, before analysis, to write, so that we can know if there is any decrease in count and motility. This might be the cause for the decreased count and motility. All these changes means this lifestyle, obesity, stress, urogenital infection and varicocele, these are temporary causes of abnormality which can be reversed. But all these habits, lifestyle change habits, everything should be done. And if you have to assess whether these have caused any improvement in your semen analysis, then it should be assessed after 3 months, because immediately a sperm is produced every 3 months. So if you take a semen analysis now and within 15 days again if you come and do the analysis, you can never analyze a drastic change. It is always good, if you want to assess any change after doing any lifestyle modification, it is better you assess after 3 months, so that you will know whether these changes have caused any change in your semen analysis parameters. So, what are the types of abnormal sperm morphology? So, earlier I explained you there are three parts in the sperm: the head, neck, and the tail. So, in the head only there are various head defects, like tapered head, means the head will be very long. Then pyriform head, where the head, a less acrosome will be there. Small head, vacuolated head. Vacuolated head means you'll have small vacuoles. So the small vacuoles and having a large vacuole, there is two difference. If you are having a very large vacuole, then it can impact the DNA integrity, DNA condensation in the sperm head, which can result in high rate of abortions and aneuploid embryos. That is the one of the thing. And the small vacuoles. So if you have any vacuolated or any severe abnormality, we while doing ICSI we do IMSI. IMSI is nothing but you analyze the sperm in a very higher magnification, that is 6,000 magnification, so that any vacuoles or anything if we see, we can select a better sperm. ICSI, IMSI or any procedure we do, these procedures does not change your morphology. It is just, but we will be able to select the best sperm among whatever is available. So if you are having a vacuolated sperm, we can select vacuoles, sperm with small vacuoles than large vacuoles. So this IMSI procedure will help you selecting in a better sperm, which can yield you a good result. Then any defect, neck piece defect is like bent neck, where it is an angulated neck, asymmetric head, or a thick piece and thin piece head. Neck is important because it is a place where there is centriole and mitochondria. So mitochondria is crucial for the motility and energy production, and centriole is very crucial for embryo cleavage, zygote cleavage. So when the zygote divides, if there is any defective neck or any defective centriole, the cleavage will not be equal symmetrical, or there can be higher fragmentation in embryo, due to which the quality of embryo you get might be moderate to poor. So it will reduce your pregnancy rate. Then the tail defect, coming to tail defect is very crucial. Like you might have high count, then you might have like progressive motile sperm might be there, but rapid progression won't be there when you have tail defect. So when you're, if you're thinking the count is high and you're planning for IUI, you might not, chances will be less, because the motility is reduced. So the sperm has to pass so many natural barriers in the female reproductive tract to reach the ampulla. So if there is any coiled tail, bent tail, or a short tail, the motility is reduced. So the sperm will not be able to reach the site of fertilization, due to which even after repeated try of IUI or natural conception, you will not be able to conceive. Hence, only count and motility will not help you in conceiving pregnancy. So in fertility clinics, we always analyze and give importance to the morphological assessment of the sperm. So if you have small head, what can happen? There'll be poor acrosome. Earlier I told acrosome is crucial for to penetrate the egg. So there'll be poor acrosome. There'll be a high percentage of non-vital sperms. Non-vital sperms means it will not be live, it will be dead sperms. So then there will be high degree of DNA fragmentation. Means DNA will not be intact, which can result in amploid embryos. If you have a very large head, which is called as megaloheads, if there is a megalohead, the chances can be, it can be due to genetic or DNA aberrations or use of sulfasaline drugs, which can cause a large head, the Crohn's disease, then this will result in high spontaneous acrosome reaction. So the acrosome reaction will be more, but the DNA part will be very poor. So this will result in lower fertilization rate. Another thing is elongated head, means the size of the head will be like a spike. So in that can be caused, one of the reason can be due to stress, urogenital infection, and varicocele. So when the temperature is high, the DNA condensation will not be proper, or they can damage the DNA, or there'll be high ROS generation. ROS is nothing but reactive oxygen species. So when ROS is high, the DNA fragmentation will be high. So when the DNA is fragmented, it will result in abortions. So and another is vacuolated head. So the large vacuoles means it should be greater than 20% of the head area. So when the vacuoles are large, it causes DNA damage. So round head is nothing but globosospermia, as previously I explained. The cause is mostly may be genetic and or unknown. So there are two types of globosospermia. One is there is complete lack of acrosome, that is typically round and there is no acrosome at all. The other type is it is a small covering acrosome is present. So in these cases, there are evidence of live birth with ICSI. So here you can't plan for IUI, IVF or natural conception. Here you have to directly undergo ICSI, that is intracytoplasmic sperm injection, through which the you can have live birth, but the percentage is less. So it is always not at first attempt you might get. You can try 2 3 attempts if you are willing to go with your own sperm. What neck defects? Neck defects, as previously I told you, it will cause defective sperm astra formation. Means the division of the zygote will be impaired, due to which the quality of the embryo will be compromised, and it will result in poor quality pregnancy. The tail defect is nothing but, as I explained you previously, when you're planning for IU or anything, the sperm will not be able to swim up to the ampulla portion where the fertilization occurs. So what are the treatments? What can be done? So when you normally walk into a fertility clinic, it is usually advisable that you get your semen analysis done in a fertility clinic where we analyze according to the WHO criteria. Means we just don't look count motility and give the assessment. We always look for the morphology, and we analyze each and every part of the sperm, if so that whatever is the outcome, you can, based on that report, your treatment option or treatment plan will be done by the consultant. So when you have mild teratozospermia, when it is borderline, just 3 to 4% of the sperm, and the female partner factor is partner is less than 35 years, and if it is not poor ovarian or you have enough eggs, then you can plan for IUI pregnancies. So, in moderate teratozospermia means when you have 1 to 2% of normal form. So, it is not 4%, it is just 1 to 2%. In those cases, IVF is like in vitro fertilization. Here, the sperm is not injected to the oocyte. The sperm and egg will be kept together and incubated overnight or for 4 hours, during which naturally itself the sperm will penetrate the egg and fertilize. But if you have 3% to 3% and the female factor age is less than 35, or there are no significant abnormality in female factor, IVF is recommended, but the chances will be less. But people who want to avoid ICSI or injection, IVF is recommended. ICSI is nothing but intracytoplasmic sperm injection. This is the technology which was introduced in 1992, and it was mainly developed for severe male factor. Severe male factor in sense you have very low no motility conditions like globosospermia, conditions like severe teratospermia, where you have significant morphological defects. In these cases, this is the technique we have used to select the best sperm among the available sperm. So this procedure only helps us to see the sperm in more higher magnification, means in a more wider view, so that we can select the best among the poor quality. Because studies have shown even people having normal forms, they will also produce abnormal sperms. So when we select in higher magnification, the rate of selection will be high. The other technique is IMSI. IMSI and IMSI is where the sperm, when we know it is morphologically very poor, here the sperm is seen in 6,000 magnification. So here we can see vacuoles, size of the vacuoles. So where is the vacuole present? So when we use this technique and select the sperm which is having vacuoles which is less in size and which is not in the DNA area, there will be higher pregnancy and we can reduce the abortion rate. So the other condition is pixie. Pixie is nothing but we select, there is a special dish where based on the natural concept, like wherever there is hyaluronic acid, the sperm, an intact DNA sperm goes and binds to the hyaluronic acid. So the pixie dish have droplets with hyaluronic acid. So we put this sperm and any intact sperm goes and bind to that well. So we select the sperm from that well to thinking that is an intact sperm with intact DNA, so that the chances of pregnancy, chances of abortion will be less. And globosospermia, as earlier I explained, we use calcium ionophore. This is nothing but oocyte activation medias. These medias, because sperm has an important oocyte activation called PLC zeta. If you don't have this enzyme, or if there is any defective production in this enzyme, it will not result in fertilization, because oocyte will not get activated. Activated means there will be no DNA condensation, there will be no genetic makeup, so that you will not have any zygote. So when the acrosome is less, or when we know the sperm is not DNA, intact DNA, then we can use this calcium ionophore media to increase the fertilization rate. So it only increases the fertilization rate, means you will have more zygotes to form a good embryos. Or when all these stances, when all these techniques are used, or when you have pinhead sperms, nothing but you will not have any size, it is just a pinpoint kind of sperms. In these cases, there is very minimal, or there are very less chances to have a pregnancy with own sperm. So you can decide your treatment plan after semen analysis. So whenever you come to a consultation, or whenever you visit a consultant for in infertility clinic, the first thing they tell you to get a semen analysis, because it is the basic procedure which outlines the basic treatment plan. So we can analyze, counsel, and give you better treatment option prior to trying all everything. If any severe conditions are there, then you will be directly counseled for ICSI. So there are various studies, various scientific papers that have produced that sperm morphology is very crucial. So anything less than 4% can result in impaired fertilization, then decreased pregnancy, then increased abortion, increased aneuploidy. Aneuploidy is nothing but genetically abnormal embryo zygotes. So, prior to planning any procedure in infertility, we have to assess the morphological feature of the sperm to plan the treatment plan. And based on the severity of morphology, you can opt for the consultant will counsel you for which is the best treatment you can undergo. So, any questions? Okay. I'll be taking the questions now. Can you get pregnant with abnormal sperm morphology? Yeah, sure. As I explained you, even in people who are having a higher 4% morphology also will produce abnormal morphologically poor sperms. But what is the difference is they will produce both equally. The percentage of normal form will be high, so they will be get pregnant with that. But when you have low count, low motility and low morphology, you will not produce more number of sperm. In that case, the morphology will, you cannot have more 4% morphology or anything. In that cases, the chances will be reduced, but it is not impossible. You can get conceived, but it might take time. It is not the time duration might get prolonged, but we can't tell. If you have abnormal morphology, you cannot get pregnant. If it is very severe morphology, you can have a IVF procedure, ICSI procedure. If it is mild form, you can have IUI procedures. IUI is nothing but when you have 2-3% morphology is less, but you have a good count and motility, it will help you in getting pregnant because the motility and count will be good. So the morphologically sperm will be 2-3% that can be tried. So even if you have abnormal sperm morphology, you can get pregnant, but we should first assess and plan and opt for the better treatment option. Does excessive smoking, drinking result in poor sperm morphology? Yeah, definitely. As I told you, there can be two causes for abnormal morphology. One can be genetic, which is irreversible and permanent. Means anytime you assess that globosospermia or any those condition, it will not change. But smoking, drinking will affect, because when the production is less or when you have more dead sperm, you will result in poor morphology. So when we change these habits and assess the sperm after 3 months, when you analyze, and if you get a good quality or a good number of good morphologically good sperms, then we can tell that this has caused the poor result. So you can reduce those habits and that will improve the morphology. Naturally increasing is nothing but if you have any lifestyle habits which are not good, we can change those habits, like as example obesity, then excessive smoking, drinking. Then you should usually consume more of vitamin D, antioxidants will really help you in the improve the sperm quality. Even if you always have want to try natural anything, usually 3 months of antioxidants are given, so then you will be assessed. So always assessment of your first analysis, and when you want to see whether all this treatment has helped you in your morphology, it should be done within next 3 months. Immediately if you do, the same sperm which is produced and stored will be assessed, so you will not find any difference. If you want to find any difference that has caused by your lifestyle modification, it should be assessed after 3 months. So healthy lifestyle, exercises, then reduce stress. Stress is very important factor which will cause hormonal disturbance in testosterone production, which in turn will result in abnormality. So stress has to be reduced. Then when if you are working in places where there is excessive heat, in factories where your the temperature is very high, So we have seen that when they have stopped that 3 months, after 3 months they have reduced the temperature visit site, or they have taken leave, they have stopped that, there is increase in the sperm quality after 3 months. So lifestyle, temperature, and all this plays a significant role. So you should assess and see, then you can rule out, yes, this is the cause which is causing the abnormality. Does poor morphology cause birth defects? Yeah, definitely. As I told you, when there's poor morphology, the DNA integrity is disturbed. So when the DNA is not intact, or when you have syndromes like sperm itself has diploidy, or there is an abnormality in chromosome DNA condensation, that will result in aneuploid embryos. And there are Y chromosome microdeletions in which cannot morphologically we can just see. But if you have to undergo, if you feel there is any genetic defect, genetic testing will be recommended. Then those can analyze if there is, that is the cause of aneuploidy. So poor morphology is one of the indication that tells that DNA is not intact. So you can undergo DFI test. DFI test is nothing but DNA fragmentation index. So that will assess whether your sperm has high DNA fragmentation. So DNA is that is the genetic makeup for the embryo. So if that is defective, there are chances of aneuploid embryo. If the aneuploid embryo gets implanted, definitely there will be birth defects. Treatments, as I told you beforely, first we should assess the degree or the percentage of sperm morphological defect, means whether it is in the mild range, moderate range, or severe range. So if it is very mild range, so 3%, sometimes when we analyze we count 100 sperms. So in the 100 sperm, if we are not getting 4%, or when we get very less, we count up to 200 sperms. So within 200 sperms also we are getting very less, then we will give a severe form. In mild to moderate form, the 3 to 4% or 3%, there is intra observed variability will be there when you get 3%. So that time what they tell with 3%, and when the female factor is not significant, IUI is recommended. IUI can be done with 3% morphology. So these are the various treatments. But prior to giving any significant treatment, first assessment through basic SEM analysis is very important. Based on that, treatment is there. There is nothing where it is only in the extreme pinhead sperms, very pinhead or very megalohead sperm, where we can't even aspirate. In those cases only we can tell that treatment is not possible with very poor sperm morphology. Does abnormal sperm shape mean that I need to go for IVF only? No, it is not like that. Abnormal sperm shape, what is the percentage of abnormality? If the percentage of abnormality is like 0%, means everything, this head, neck, tail, everything is defective, then yes, you have to go for IVF. But first we should assess the percentage of abnormality just based on one per, if it is 3% also you can try IUI. And as I told you before, there are studies which have shown that even with 0% normal form, people are able to conceive naturally. But the time duration and the chances will be less, but there are chances, but the percentage is very less compared to people who are having high. Like if they have 60% chance, you'll be having 1 to 2% chance. That is the chance, but you can never tell. If it is abnormal, you will not be able to conceive. Or IVF is the only procedure. First we should assess the percentage of abnormality, then plan the treatment accordingly. How does sperm quality affect IVF success? Yeah, sperm quality, as I told you, when we have planned already for ICSI, the count and motility is should be, it should not be like, it should be normal. Even if it is less, because ICSI is mainly for severe male factor. Severe male factor means if they are having very less than 1 million count, 2 to 3 motile sperms, then morphology is also poor, ICSI is the recommended course. In that case, what we will tell you is that might be you will have a low percentage fertilization. Might be all you get 100% won't be there. and quality of embryo can be moderate quality, moderate to average quality. So that time what will write more, if we tell 60% success, the success can reduce to 30 to 40%, but it will depend. Even if the oocyte quality is good and oocyte quality is not compromised, then the chances increases, because oocyte always compromises for a poor sperm. So if the oocyte quality equally is bad, then the success rate will be, definitely will go down. So prior to telling what is the percentage of success, we have to assess, and it is only on the ICSI table we will, through the microscopic examination, we will know what is the quality of oocyte. Sperm can be always assessed prior, but the oocyte quality will be assessed only during ICSI, because we just see the size of follicle or anything only after aspiration. Only when we are injecting, we will know what is the quality of oocyte. But sperm, it is not that case. It can be assessed prior to treatment being started. Are there infertility? Yes. Genetic they are seen that globosospermia or cartigenous syndrome or the defect in Y chromosome microdeletion, all these, there are genetic makeup which can cause male infertility, which can affect. And aging also affect fertility, but the percentage is every 20 years. It is not like every 1 year you will see any change. It is every 20 years you will definitely see change in motility count and morphology, but the percentage is very minimal. It is not very high. Does family history matter? Family history, in the sense, if they're having the same globosospermia or this cartigenous syndrome, we have to first analyze genetically what is the thing. Then family, we, if they have done the test, and we can, prior to starting, we can analyze just to check whether it is not present in the person who is being assessed.
Thank you, doctor. That
Okay,
was
my
the
question.
last question that we had.
Yeah.
It was a very informative session, doctor. Is there anything that you'd like to say in conclusion, doctor, before we close this session today?
Yeah, I just want to conclude that semen, if you're planning for pregnancy after 1 year or 2 year of married life and you want to visit a fertility clinic, I would always suggest visit, do get the analysis done in a fertility clinic, because it is just common thing I want to address. Many people come with the analysis report done in a diagnostic centers, that varies from fertility center, because we analyze each and every part of the sperm through microscopic examination, and we follow the standard WHO criteria which is internationally followed. So in diagnostic, they just see the motility count, and they will just do a microscopic single view examination. But here we count motility is assessed in each step. We do slide, we check in slide, we use stains to see whether the acrosome is present. Then we do slides to assess the morphology. We check head, tail, everything we check. So there'll be a variation when you do in a fertility clinic and when you do in a normal diagnostic this. So it is my suggestion to all viewers that just don't compare that and this, because fertility we assess deeply. So whatever assessment is given after a deep analysis. So thank you everyone. Any questions you can
Thanks a lot, doctor.
address
This
all
was
the
such a
questions.
very informative session. Thank you, everyone, for watching Apollo
Okay.
Fertility session today. Stay tuned with Apollo page for more such sessions. Thanks a lot, doctor. Thank you.